Good afternoon, everyone. I'm glad you could attend this educational seminar about major depressive disorder, commonly abbreviated as MDD. So, my name is Amilcar Ahilon Mendoza. I'm a licensed physician psychiatrist at the Atrium Health Floyd Clinic in Rome. I specialize in addiction and mental health disorders in both inpatient and outpatient care, specifically to the Northwest Georgia adult residents. On your seat was a name tag. Please put on your name tag so that I can associate a name with a face so that we're not strangers. Making sure that everyone has their name tag. Okay. A little about myself. I am a first-generation Latinx college graduate, and my most recent education was at the Emory School of Medicine, where I went to medical school and did my residency at Atrium Health here in Rome. Before I went to medical school, I actually studied at Georgia State University, getting a master's in nutrition, a master's in public health with a concentration in nutrition through their coordinated program because I wanted to sit for the RDN, but I chose to do an MD instead. Before that, I studied here locally at Georgia Highlands College. I was a health science major. I had gotten my bachelor's in the end of 2024, and I've gotten my associate's of biology at the end of 2022. Why am I here, you may ask? At a college campus filled with healthy and adventurous students, why is the medical doctor here? In my field of work, I have noticed an increased rate of admitting college-age students around 18 to 20 years old coming with extreme cases of major depressive disorder, also known as MDD, who require clinical intervention for overwhelming feelings of self-harm or a pessimistic mood interfering with their daily life. So, I want to ask a very personal question, but please do not answer this question. Has anyone in the room felt helpless, worthless, or even suicidal during a life-changing phase of continuing their education? While dealing with everyday problems associated with life and work, do you feel like it has become too much to deal with? While contemplating your answers, please reach down under your seats and write your responses down on the index cards provided under your seats with the Sharpies provided. Okay, so once you're done with that, we were going to do an icebreaker, which would basically be, I have in the center of this circle around here with us, with your response, I was going to make the participants go to the center of the circle, grab an Amazon stuffed plushie that has like a mood response that most people use in therapy. With their index card, they were going to stuff it in the shirt of the doll. And to the person on their left, they were going to tell them, hey, this is my name, this is my major, this is what I'm studying. And if they felt comfortable, tell them why they had chosen the doll specifically, because it would exhibit a specific emotion during this icebreaker, just to get everyone familiar with one another. Okay, so to begin with my presentation over major depressive disorder, at the bottom here on my notes, I have a link to my quizzes. No. Okay. I'm sorry. Okay. So that was the icebreaker directions. I'm going to go over right now over my PowerPoint. This is my PowerPoint over major depressive disorder, or commonly abbreviated as MDD. It is presented by me, Amilcar Ahilon Mendoza. I'm part of the Department of Behavioral Health there at Atrium Health, and I do have my master's, and I am a medical doctor. So I have MD and MPH for my credentials. Okay, let's get started with our present. Okay, let's get started with our presentation about MDD, Major Depressive Disorder Awareness. So, my goals and objectives of this presentation is goal number 1, to increase knowledge of major depressive disorder among college students here at Georgia Highlands College. Goal number 2 is to decrease the stigma surrounding major depressive disorder among college students here at Georgia Highlands. I have main 3 primary objectives. Number 1, by the end of the lesson, at least 50% of participants will recall one mindfulness exercise tool recommended for practice in depressed individuals to influence their self-talk, or otherwise known as their head voice, for an optimistic mindset. Objective number 2 is by at least at the end of the lesson, 70% of participants can define major depressive disorder accurately in their own words. Objective number 3, at the end of the lesson, at least 20% of participants will evaluate their mental health state to see the likeliness of depression from recorded responses in the patient health questionnaire of moderate to severe symptoms. Major depressive disorder in everyday life. Everyone responds differently to major depressive disorder, and it can vary in a wide range of emotions that look unique in each person, from children to teens, specifically to adults. Behavioral and physical symptoms are not limited to, but mostly include no longer going out, not being able to concentrate at work or school, no longer doing hobbies and extracurriculars they once enjoyed, changes in their eating habits, like eating too much or very too little, which can, ultimately lead to fast weight gain or a lot weight loss severely. Insomnia, which is difficulty sleeping, or hypersomnia, which is sleeping too much. They're either trying to avoid by sleeping, and having a strong sense of fatigue, persistent feelings of tiredness. The feelings and ideas commonly found in MDD patients is they're indecisive. What do they want? They're irritable, primarily in children. They're heavily disappointed in thoughts of that I'm a failure, or that they have ideas that they're worthless. And their emotions are overall in a miserable state. They tend to blame their MDD diagnosis like it's my own fault. Being alive is no longer worth it, and people will be happier with me gone. These are the common ideas in a patient suffering from MDD. So what is the definition of major depressive disorder in a clinical setting? The Cleveland Clinic defines it as a mood disorder that causes a persistent feeling of sadness and a loss of interest in things and activities you once enjoyed. How do healthcare professionals, like myself, differ in depressed feelings versus depression? So like how you feel kind of depressed versus a clinical diagnosis of depression. Well, it is to be evaluated to be depression only if the symptoms and feelings are experienced daily for 2 weeks continuously. That's an important note. Experienced daily for 2 weeks continuously. There are several different types of depression, but major depressive disorder, aka MDD, is also known as clinical depression, is the most common and considered by clinical professionals to be the most severe type of depression. The diagnosis of depression is made by healthcare professionals, i.e. primary care physicians and mental health professionals like psychiatrists and psychologists, who can view your symptoms, medical history, and prior mental health history, ruling out underlying chronic conditions for mood imbalances while assessing the context of your systems to define specific depression you may be experiencing. Now, I highlighted the point of ruling out underlying chronic conditions because if your mental health is in a poor state, your physical health may reflect a poor state as well. And here's an infographic of the overall 6 major types of depression: major depressive disorder, perinatal depression, which occurs before and after childbirth, also known as postpartum depression, premenstrual dysphoric depression disorder, severe depression, anxiety, irritability before menstruation, persistent depressive disorder that occurs for most of the day but not all day, seasonal affective disorder, also known as SADS, is typically onset by a season change, and atypical depression, which is diagnosed by MDDs and includes mood reactivity. Atypical depression is very rare, but it does occur. Common reasons for MDD. These are the general reasons to explain why a patient may have gotten MDD diagnosis. The American Psychiatric Association highlights three main categories that are common for risk factors for MDD. Biomechanical or your environmental factors are a social history of substance abuse and alcoholism, so like drug dependency in a family scenario, social history of substance abuse and alcoholism, stress triggers like financial issues, marriage, or education issues, which can cause the hormone cortisol to affect the neurotransmitter serotonin and lead to depression. When you're stressed out, your body basically goes into survival mode, and when it gets triggered to be like, oh my goodness, I don't know what to do anymore, the hormone cortisol can cause a huge hormonal imbalance to cause severe emotions that feel like depression. It could also be a genetic predisposition from your family history of depression, from your maternal and paternal parents, your grandparents. It's estimated to be around 40% of the time genetics determines whether or not someone will become depressed in the future. Also, your personality could be a huge factor. If you have a negative mindset, usually falling under a pessimistic mindset, you could increase your chances of getting depression, and have an introverted personality, which causes you to be not really a people's person, but rather to your own self. And this social isolation could trigger effects of you not seeking help or not seeking the social support that most of us need, which can trigger feelings of isolation and, feelings of negative mindset to cause you to further escalate your depression to a higher risk. Okay, differential diagnosis or explanations from a doctor. It could also come from reasons of medications or substance abuse. I've explained a little bit about alcoholism, but specifically steroids, antihypertensives, antibiotics, sedatives, alcohol, stimulant withdrawal. So like a caffeine crash or a sugar crash, or even when you're going out without your cigarettes, you may experience withdrawal symptoms, which can trigger a response to your body to go into a panic mode, which can cause common feelings associated with depression and anxiety. Nutritional deficiencies such as vitamin D, B12, B6 deficiency, and iron deficiency. This, added with social isolation and improper nutrition, could cause mixed signals, which why I highlighted it, to your brain for inactive mode, which basically makes you feel like you're not going out much, you have an unhealthy diet, your physical health is declining, and so this direct relationship with your physical health will reflect your mental health also deteriorating. And this figure right here basically explains it by biological and psychosocial and cultural factors may trigger MDD, but MDs, your doctor, would basically, clinical management will include nutritional intervention. So we have to talk specifically about your diet. Unhealthy dietary habits, could primarily lead to unhealthy lifestyle and chronic comorbidities with on top of your depression, which can cause a pleiotropic effect such as inflammatory responses, MGB axis, HPA axis, neurotransmission, which could, undercause serotonin and selective serotonin responses in the brain because you already have a bad diet and you have a poor health. Another reason could be neurological causes such as cerebrovascular accidents, epilepsy, Parkinson's disease, Alzheimer's disease, which is, from brain trauma, diabetes, thyroid disorders, adrenal disorders, which explains your fatigue, metabolic disturbances such as hypercalcemia, hypernatremia. Body is not in your homeostasis health. It's not in the best health, which could cause your foul or negative mood. So, college students, the rising mental health crisis overview part 1. In the United States, physical health care continues to be a significant issue for working class Americans who are either, number one, uninsured or overwhelmed with the legal complexity of health insurance. National insurance for medical coverage is hopeful wish in the United States compared to other developed nations like the United Kingdom, France, and Canada, which have shown some national-sponsored governmental health care support for their citizens, who are not only fighting COVID-19, but also the rise in mental health disorders in their demographics. The controversial idea of national health care for Americans has been debated among financial analysts, legislators, political leaders, and college students. The controversial idea of national health care for Americans has been debated among financial analysts, legislators, political leaders, and college students who demand a collective, humane effort from leaders to provide adequate health treatments and address inequalities within health reformations. So this infographic demonstrates mental health in college students crisis, which is around 40 million U.S. adults have a generalized anxiety disorder, and 75% of them experience their first episode of anxiety at the age of 22, which is, a huge demographic of college students. This basically states about anxiety and negative correlation between academic performance and mood disorders such as depression and anxiety. Moving on, college students, the rising mental health crisis overview part 2. The college students are expected to not only afford college costs, living expenses, and health coverage. This is concisely explained as programs, which is, i.e. health insurance, were created in part filling coverage gaps left by private insurance market, namely coverage for the elderly, disabled, and low-income populations who had too little income and too high health risks to be viable candidates for insurance coverage. So if you're a college student already with poor mental health, poor physical health, you will most likely get a very expensive health insurance plan if you're not provided or fortunate enough to be covered by your parents' health insurance. Political instability with rising inflation rates that make college towns more gentrified and unaffordable makes the average college experience even more isolating and unpleasant, with academic stress and emotional uncertainty that in this life phase for most 18 to 25-year-olds in the United States, which have been noted by academics, these horrible trends of MDD, which a growing percentage of adolescents in the United States live with major depression. The prevalence of mental illness is the highest, 31% for those younger than 25 years old, 67% of the college student demographic. As the 26 to 49 age-year-olds show that they're the second largest fraction affected, mostly around 25%. Graduate students are more than 6 times as likely to experience depression and anxiety as compared to the general population, with 41% of students showing signs of anxiety and 39% moderate to severe depression symptoms. Alarmingly, suicide was the second leading cause of death among individuals between the ages of 10 to 14 and 25 to 34, and one-third of those between 15 and 24, which was cited by Pester et al. In 2023. I would like to highlight that the statement made by these researchers that more than 6 times that you have susceptibility to MDD and anxiety when you further your education to graduate school, which highlights a very morbid trend among higher education in the United States. So, what is the college student, the rising mental health crisis? The same medical professionals who have survived, aka me, the challenges of medical school, and by exceptionally performing while an undergraduate to secure their post-grad admissions to reflect the culture present in the student body, particularly in STEM. Although the universities may provide sufficient alternatives to de-stress their students, many universities fail to recognize that academia fosters a mindset that has irreversible consequences of the mental health of once extraordinary performing students, ranging from reasons of burnout, poor self-care like hygiene, and isolating themselves to study more so that they can hustle to become to to be part of well-earning careers and prospective careers that mostly is fostered in the area of STEM. Coincidentally, there is a direct relationship between rising rates of poor self-reported mental health of college students and their professors who are complacent with the toxic and self-destructive cycle of academic peer pressure. The article further highlights this, stating that there can be a culture of this, which is supposed to be hard. It can often be challenging for students in early career academics to recognize this inappropriate levels of stress. This can lead to self-doubt about something being supposed to be hard and whether the levels of stress and sacrifice are normal, appropriate, and in fact necessary. The line between challenge and suffering becomes blurred and can prevent those affected from seeking out necessary guidance and help. The suffering Olympics is another phrase that evokes the culture of bragging about the lack of sleep and working hours and busyness. Again, from the same article of Pesser et al. In 2023. I want to highlight this bolded quote just to note that the idea of culture of STEM, that you have to study yourself to death, is actually very toxic to have while pursuing your higher education, because this will directly affect your mental health and directly state your self-worth as a student. But you should be able to study, but it should not be the reason for you to deteriorate your own mental health. So, I know this is a lot, but I do want to cover the importance of the historical context of depression. This is noted as the overview of misogyny, or the origins of depression, which is basically summarized as this. An essential goal for both healthcare professionals and aspiring STEM-oriented majors like health science, aka us, nursing, and pre-med track undergrad students is to aid to overcoming the barriers that may cause depression. One study highlights factors known as concealable stigmatized identities, or CSI, which will be abbreviated as CSI, that are primarily your gender, race, ethnicity, and your sexual orientation self-identities, which in this context of academic research do show some link to higher rates of harmful and traumatic experience while enrolled in higher education. This is further explored as experiences of students with depression, one of the most concealable stigmatized identities, in the context of undergrad research. We'll use CSI identities to understand that students reveal or conceal their depression in the context of undergrad research. So students who may have higher barriers to higher academia in the United States, such as social factors of their gender, socioeconomic status, and their race, these students are already suffering in a white-dominated space. But adding CSI factors into higher academia, and plus the toxic cycle of STEM majors, it could make students feel not about speaking up or advocating for themselves when their mental health is at their all-time low. So, the abuse endured by women in the 19th to 20th century for the advancement of mental health has become overlooked when understanding how depressed individuals can experience discrimination and violence due to unfounded fears of mental instability. I want you to picture depression, and when you think of a depressed individual, some people may go to, the traditional, I'm just sad, I'm hysterically crying all the time, but others may have a more historical perception of depression, which I would like to highlight as, the people with the straitjackets, who are self-harmful to themselves, who could hurt themselves. And yes, this is an extreme, but the negative stereotypes and perceptions among depression will hurt people who are trying to seek professional help. The cruel treatments in the past demonstrate how social pressures was a stressful situation which contributed to the manifestation of dissatisfaction, anger, frustration, and aversion, all aspects wrongly attributed to depression. This is also known as pre-upbrial insanity, which was historically relevant back in the day, known as postpartum depression and psychosis, which was very often used as a reason for admission to asylums. Approximately 2/3 of females. Women, for a result, the number of female patients in the asylums was higher than male inmates, typically 66%. Understanding the history of depression and what success in the past could help explain why depression continues to be A, misrepresented in pop culture, and B, dismissed or overlooked by society because they may dismiss the struggles of depression of people who suffer from depression to be either two of these, postpartum depression and psychosis, and primarily negatively affects women who may believe they are just feeling these hysterical emotions rather than actually, considering that, oh my goodness, this could be a reflection of my declining mental health. So, sexism in medicine is not, it's not a new phenomenon, but we do have to explore and consider these social factors when trying to figure out how do we move on for depression research. If you are alone and depressed, college can be difficult for anybody, especially for those in the newer transition from teenagehood to young adulthood, away from home and alone. The social isolation of the vast college campus you choose to attend can add to the refusal of students to dismiss their negative feelings to allow their depression to go untreated. This is discussed further by studies that show that students with mental illnesses and factors of CSI, such as anxiety and depression, experience stereotyping as a threat to their academic setting. That is because there can be a stereotype that people with mental illness struggle academically. When people with mental illnesses are in a situation where they believe their academic ability is being evaluated and their identity is relevant, they tend to underperform compared to their counterparts without. Do not let this discourage you to seek treatment. All because some may assume, oh, well, you have a mental illness, obviously you'll be struggling in college. No, college is there to add some helpful resources for you to alleviate your pain and your distress, but also seek out medical treatment because we can help you with this mindset that's all psychological and mental in your own mind. That we don't want you to fail out of college, basically. We want you to perform well. And by doing this, you take the first step into mental health intervention. Inadequate research of depression. Despite the continued interest and Gen Z support for mental health awareness, the destigmatization of antidepressants from influencers and celebrities has allowed this declining effective research method to finding alternatives to treating depression. What do I mean by this? I basically mean that a lot of people who are, advocates for mental health, they may say, well, this drug is a miracle, it'll cure you. But most of the times, if it doesn't help you, you may feel helpless and be like, well, it's not helping me, what am I to do? And with pharmaceuticals, it could be a great help, but if it doesn't help you, that's okay. You should be able to seek out other alternatives, things that make you feel comfortable and make you feel like you're taking charge back in your own life. An article on the bibliometric mapping of mental health on the international level has highlighted the importance of inclusiveness and social awareness that would also benefit from a greater volume of research from social sciences and the humanities, exploring the influence of social, cultural, economic, and educational factors on the conceptualization, manifestation, and experience of mental health and well-being. Because again, pharmaceuticals can only do so much. College should also reform the system itself by adding the factors of social factors, cultural, economic factors, and even education stages for a lot of students. Some students may be first gen, some students may be legacy, some people come from more affluent backgrounds, which could cause limited resources when considering the student body demographics. This perspective, alternative methods of Western medicine that rely on the prescription of antidepressants can be helpful with coinciding with mindful practices that can support others in getting the appropriate treatment for themselves. So you should be able to advocate as a patient for your own treatment, which you feel comfortable. If pharmaceuticals isn't it, then you can always speak with a primary care physician to seek alternatives. So reasons as to why college students, the target audience, have a higher susceptibility to depression. In summary, the phenomenon of higher rates and relatively healthy demographics of college-age students is an underlying systematic culture of survival of the fittest, which a lot of people use in biology, While enrolled in college courses, which can lead to the psychological distress outcomes among a cohort of undergraduate, graduate, and professional students in the southern U.S. In June 2020 was strikingly high. Clinically significant levels of symptoms of depression were reported by almost two-thirds of the students among samples of the United States college students interviewed at a similar time during the pandemic. 32 to 48% screened positive for major depressive disorder or showed a moderate to severe level of depression, which was founded in the Giovanni papers in 2020. So, add health insurance, political instability, income disparities, health reform disparities, along couple-sided with academic distress, basically makes it a huge breeding ground in academic settings for major depressive disorder, which is why I want to reiterate that college students do have a higher rate for major depressive disorder. MDD is affecting higher education in the United States. Higher education in the United States has been in shambles ever since the lockdown during COVID-19. Our responsibility as current students and healthcare professionals is to address the unique factors contributing to the departure of burnout students who receive inadequate care from their universities, while paying ludicrous amounts of tuition to obtain a subpar education that undervalues its students. This is a peculiar issue for the South, who can experience various factors of being first-generation college students and a community that overlooks the importance of education, which is highlighted as rural students, low-income students, and students with a low GPA were most vulnerable to psychological distress. These students have already faced multiple barriers in pursuing higher education, and additional mental health issues will put them at a high risk of dropping out of college. Lastly, although they would drop from the main analysis due to the small sample size, it is still noteworthy that a significantly higher proportion of LGBTQ plus students in our sample experience severe stress, anxiety, and depression, which calls for significant attention and care for these students. Despite the high prevalence of mental health problems, a majority of students with moderate to severe symptoms never use mental health services during their academic year, even though the university provided free counseling. This result could be partially explained by the fact that the University Counseling Center switched from virtual counseling since the COVID-19 outbreak, which is available for students who stayed with the state due to the license restriction across states. So basically what I want to highlight is that virtual counseling and in-person counseling, virtual counseling is good for those who suffer social anxiety or may feel uncomfortable speaking with somebody about such an intimate topic. But when counseling services no longer offered virtual counseling, they may have lost a potential amount of students who may feel uncomfortable speaking out to somebody. They're already not speaking out to their primary care physician. If they have one, they more than likely will not utilize mental health counseling services available to their campus at low cost or free. Appropriate treatment options for major depressive disorder. Psychotherapy treatments could include interpersonal therapy, which focuses on the patient relationship with others on their life, which is a one-to-one interpersonal resolution, where you're talking to somebody to help you with your depression symptoms. Or supportive therapy, a mix of the techniques such as cognitive, behavioral, and interpersonal therapy to improve systems through a group effort. So this could be like a intervention when you do with substance abuse, like alcoholics. You can talk to your loved ones, your therapist, your counselor, your guidance counselor at your university, that you could all speak, have time to speak, and include your own perception of how you feel like you could do, how you could take charge in your own life to improve your mental health. Medications include SSRIs, which are selective serotonin reuptake inhibitors. This is the first line of treatment usually prescribed for depression. The safer ones with less side effects, common examples include Prozac and Lexapro. These are their chemical names, but you would most likely use the brand name, Prozac and Lexapro. Serotonin non-reuptake inhibitors, which is also known as SNRIs, treat depression and other mental health conditions like anxiety. Again, the brand names are Preceq, Cymbalta, and Fetazima. Selective serotonin 1A, 5-HT1A receptor agnostic XUA, which XUA has no risk of weight gain and sexual dysfunction, which is a common side effect of most SSRIs, which is also common in Sertraline, which I may have to disclose I am personally taking for my own depression. Now, a heavy topic such as suicide, when people do not get treatment for their depression, then it can cost them their life. Recognizing the signs early on for depressed loved ones can help guide them to a better state of mind that doesn't end with suicide. Coping with depression is already tricky and isolating, and triggering physical pain as punishment is a way to cope for many individuals. Notice the signs and get help for them, or they can ultimately be gone within the next day, with a fact stating depression accounts for nearly 40,000 cases of suicide each year in the United States. It is essential to get medical help as soon as possible if you're having suicidal thoughts. Call 911 and speak with a medical professional, and or if you need to, seek guidance and counseling help. Mindfulness treatments available. I do want people to understand that yes, you can go the medicine route. You can speak with a primary care physician. You can always go to counseling. You can get therapy. But ultimately, when you're alone, sometimes you go into dark places in your mind for depression. It doesn't have to be that way. You can always try to practice these when you are alone, or if you need to remind yourself your depression does not define you. Maybe you could always do these simple, fun mindfulness exercises. Pay attention. It's hard to slow down and notice the little things around you. Take time to experience your environment with all your senses. When you go out, look around. Enjoy the time that you're out, or if you are socializing, remember that this is not the end. Things can get better. And notice the little things. Enjoy time with loved ones, your loved pets, your friends. Do anything like that. Something that brings you a little bit more joy. Live in the moment. Find joy in simple pleasures. When you go out to walk, you can breathe in refreshing air. You can go to school, hear students being alive, typing away at their laptops, and just remind yourself, I don't have to be alone. My mental health does not have to keep me isolated in my room. I can still go out. Or, for a lot of students, like we've noted, LGBTQ students, accept yourself. Treat yourself the way you would treat a good friend, parent, sibling, pet, and maybe your potential significant other. Being in a pessimistic mindset and self-hating yourself could be the origin to why you may be experiencing major depressive disorder, because basically you're not loving and accepting yourself. You're gonna put you're your biggest antagonist. You're hurting yourself. You're keeping yourself isolated. You're keeping yourself down. You don't want to see the positives. Learning to self-accept may be your first step to actually improving your major depressive disorder. Focus on your breathing. Relinquish those negative thoughts. Try to sit down. Take a deep breath. Close your eyes. Focus on your breath as it moves in and out of your body. Remind yourself you are strong enough to continue being alive. As we all know, suicide is the ultimate, do I keep going? Do I not? Given the pessimistic ideas they go through, the miserable mood, remember that you are worth being alive. You're contributing to, you're an important person in your own life. Never forget that. And treatment information, speak with your primary care physician, or speak with a parent or a sibling who you know can support you, who doesn't feel uncomfortable talking about mental health interventions. You can always seek out counseling services while enrolled at your university, primarily at Georgia Highlands College campus. Does offer 4 lines of support. You are not alone, and we are here to help. If you do scan this QR code, you can basically rate how my presentation is, and it will also lead you to a link that will give you my contact information so you can seek out treatment if you would like to talk to me over your over some symptoms or how life is going on for you right now. So after the PowerPoint, I would like for us to do our activity, which is basically starting out with our patient health questionnaire, which will take around 5 minutes, I'm hoping, for y'all to fill out. Underneath your chairs, there is a physical copy you can fill out for yourself. You could always refer to Appendix B. That is where the questions are coming from and how they made you feel. And then another one I would like to do is for 10 minutes, I would like to allocate my time for people to talk as kind of like a therapy discussion. We will have an open-ended discussion with all peer reviews, including myself. Opening discussion question would be, recall one mindfulness tool that we discussed recommended for practice in depressed individuals to influence their self-talk. Or, how can you help yourself or others who may be experiencing MDD? This will basically cause us to create intimate information and recall everything we have learned from this PowerPoint. And the closing activity would be to go on quizzes to do where I was supposed to do the pre-test and the post-test to evaluate who had paid attention and who learned something new and stuff like that. Of course, again, closure and exiting, you could always scan this QR code to let me know your primary feedback, and you could always answer some more questions. Like, I should be guiding questions once everyone is getting out and leaving. I could always ask questions like, what is one thing you learned about MDD? What healthcare professional can diagnose MDD and offer treatment options? Where should an individual suffering from depression seek treatment? What is one mindful exercise to decrease negative feelings of shame? What clinic locations in Georgia may specialize in mental health services? Again, my department is behavioral health at Atrium Floyd Behavioral Health Clinic, which offers free to low reduced costs for MDD treatment. Do you have any final questions? And if not, everyone is free to go. And thank you again for coming to my lesson. I'm very hopeful that you have learned something necessary and you can use the knowledge you've learned from here and apply it to anyone who may need the help. Again, thank you so much. My name is Amilcar Ahilon. Thank you for listening. Goodbye.